Ovarian cancer is a silent killer for us women. Raise your hand if you have had a female in your life that you've known was perfectly fine one day, went to the doctor, and all of a sudden she has a progressive ovarian cancer diagnosis. And unfortunately, those women and the stats for women who are diagnosed in stage, it's not favorable, and it is heartbreaking. Today, I want to share with you some of the common symptoms of this silent killer. One of the most significant obstacles and challenges with an ovarian cancer diagnosis is that the symptoms are common with non-cancerous conditions. You might have one or multiple symptoms and not really think about them. They may even be persistent but not too concerning. Today I'm sharing with you why leg pain is one of the most uncommon but common silent symptoms of ovarian cancer. I'm sharing this uncommon but common symptom as well as 12 others that you need to be aware of and mindful. If you are concerned about your own risk or maybe a loved one's risk of ovarian cancer, today's video is going to be extremely impactful and potentially life-saving. Let's go. If you have any thought in the back of your head or concern or inkling that maybe your symptoms might be ovarian cancer related, this video is going to be extremely helpful. Or if you're like me and you've turned the corner into the middle ages of your life, I'm going to share with you some of the most powerful symptoms you need to be watching out for. And ladies, know that the median average age of ovarian cancer is 65, but there are women I work with in their late 20s, 30s, and 40s who have ovarian cancer. So no age is discriminated against when it comes to this progressive and often late-stage diagnosed cancer. There are screening tools, and I'll talk a little bit about them in today's video. So let's dig into the most uncommon but common signs of ovarian cancer. Number one is bloating of the abdomen. This could cover the gamut of feeling swollen, feeling like you're holding more fluid. This can be progressive, where you gently are kind of noticing that your abdomen is getting a little bit more swollen, or it could be sometimes within the matter of a few weeks or sometimes seemingly overnight. Swollen, painful, uncomfortable, puffy, and stuffed is going to be the feeling that a lot of ovarian cancer patients describe. Often they will say that they feel a fullness in their abdomen. And when we press and palpate the abdomen, it's not smushy and squishy, but it will be hard. And so just be aware that the bloating you might be experiencing might not be digestive bloating. Number two is an array of urinary issues, from frequency and urgency of urination. This runs the gamut of frequency in terms of how many times or how many trips are you taking to the restroom. It can include volume, and in some cases, it can include a difficulty in urinating, feeling like you're not fully emptying your bladder. There might be blood in the urine, and it can also accompany pain in the whole entire urinary process. This is really tricky because many women think that they've got UTIs or have repeated, frequent UTIs and they're managing it over the counter. This is a cause to have a visit with your OBGYN and get the necessary screenings like a pelvic ultrasound and a blood test called the CA-125. Number three is GERD. GERD is indigestion, heartburn, and persistent kind of upper GI pain that is not treated or responsive to medication. This can be after women eat, and then sometimes if they're feeling really full, they don't even have to eat and they're experiencing GERD and heartburn. Number four is going to be lower back pain. Often it's unexplained, chronic lower back pain. It might be something where you think, okay, I've overdone it in the gym, or I was working out in our yard, or whatever activity might be. You might kind of see it falls under the radar, but this kind of lower back pain from the hips up to just below the kidney region, that whole lower back region can have unexplained chronic pain. Number five is going to be pain during intercourse or discomfort during intercourse. Now this is really common if you are perimenopausal or menopausal. And so this can be a challenging symptom that often gets swept under the rug, and we think that it is something unrelated, but but could very well be related to ovarian cancer. Number 6 are changes with your menstrual cycle. Maybe they've gotten lighter, maybe they've gotten heavier, maybe you're missing some periods, maybe you're postmenopausal and all of a sudden a period has showed up, or you're spotting lightly. These are definitely symptoms that can be associated very easily with hormonal changes as we age, but are common symptoms of ovarian cancer. Number 7 is persistent nausea or persistent vomiting. This is in its own class or category, very different than GERD, but women that experience nausea and vomiting frequently, and it's unrelated to food poisoning or any type of food intolerance or something that's disrupting the process of their stomach. Maybe they think, oh, I've taken a supplement and I'm feeling nauseous. That nausea and vomiting that is persistent, frequent throughout the month, is something that needs to be addressed. As I said in the introduction, number 8, leg pain is a common, uncommon symptom. This is going to be leg pain that's isolated to one side, left or right, and it may often be masked, or we think that it's sciatica. Now, this is a type of pain that can feel like sciatic pain, a hot, burning, irritated pain, and even numbness on just one side. That side is often the side that is dealing with cancerous cellular activity when we go in and assess and diagnose women with ovarian cancer. Number 9, very similar to the leg pain, is going to be one leg that is swollen or more swollen than the other leg. This is going to be persistent with the development of the cancer and the progression of cancer and the accumulation of lymphatic fluid. You might know I am a lymphatic therapist. Along with my doctor in naturopathic medicine, I specialize in women who are going through an assortment of cancer diagnoses and addressing the swelling, the lymphatic impairment that cancer or the post-surgical, post-chemo treatment creates. And so this is something to be aware of. If you notice you have gentle swelling in and around your ankle or the lower limb, the lower extremity, that lower extremity edema is common for a moderate to progressive stage of ovarian cancer. This gets commonly misdiagnosed and swept under the rug and ignored. Unfortunately, swelling of any sort is kind of outside the box of comfort for a lot of clinicians, and it is an important sign, an uncommon sign of ovarian cancer. So number 10, because of the proximity of your ovaries and your bowels, bowel changes are a big part of the symptomology of ovarian cancer. This could be a symptom of constipation, it could be a symptom of diarrhea, or a combination, which is really challenging because that combination, diarrhea and then constipation and back and forth, could be IBS. So you're starting to see trends that a lot of these symptoms, when we look at the bigger picture and you're checking off 4, 5, 6, 7 of these 13 symptoms, you might be dealing with ovarian cancer, and it's important to get the screenings. Number 11 is going to be lower abdominal and lower pelvic pain. This will feel like deep-seated pain in the lower pelvic pubic floor, and it will be persistent. And it might be located left or right side, but it's very common that it's going to be that whole region. Because of our nerve bundles and the way we process pain in the abdomen, it will feel like the whole entire abdomen is just rich with pain. Number 12 is a really common symptom that every ovarian cancer patient describes, is unexplained fatigue. This could be mild to moderate to debilitating fatigue that is addressed by our medical community. I recommend ruling out these labs and these lab values to ensure that you've checked the boxes in ruling out other possible causes of fatigue. Test your cortisol, test your iron, full iron, total iron, get your ferritin levels, check your B12, and also have a full complete value of your thyroid labs. If those all come back normal and in good, healthy, optimal range, then the unexplained fatigue is definitely something to dig further into. And last and final, one of the most uncommon but common symptoms of ovarian cancer is a lack of appetite. A lot of times that feeling of fullness, the fluid retaining, and the edema in the abdominal cavity, because of the cancer, it presses up on the stomach and can yield a situation where you don't have an appetite. And I know there are probably some of you who are like, geez, that would be great if I didn't feel hungry. The reality is that the cancer, a lot of times it's progressive, 3rd and 4th stage ovarian cancer. It's encroaching the tissue, and the cancer cells are encroaching on the abdomen, and the amount of fluid that is being built up by the lymphatics because of the cancer impairment, we are having a situation where it affects your stomach's capacity to hold food, and even just overall feel like you're hungry. So if you have weight changes where you're losing weight, or a rapid weight loss and it's unexplained, and you have a loss of appetite, this is definitely a symptom to address. All of these symptoms are things individually that could be related to other health conditions. Collectively though, and I want you to go back and watch and replay and just write down what numbers are you experiencing. If you're experiencing more than 7 of these symptoms, close to half of these symptoms, it's important that you schedule an appointment with your clinician and say, I want to be screened for ovarian cancer. I'm having symptoms and I want to rule it out. There is no harm in you asking for these labs and getting an appointment to evaluate your potential risk factor and have the testing that could determine and rule out ovarian cancer. Screening and awareness is important. It's one thing to know what the symptoms are, or the common and uncommon symptoms, but we need to bridge the gap where you communicate with your clinician, you demand the right type of screening, fire a doctor or two if you have to get the right testing, and let's start catching ovarian cancer earlier, so that we don't all raise our hands knowing a fantastic woman in our lives who's gotten in-stage diagnoses of ovarian cancer. So I'm dedicating this video to Mary, a cousin of ours in Minnesota, who I knew and loved as a young child, who suffered very quickly with a late-stage diagnosis. And I hope that the Marys in your lives we can impact with this video. So please hit the share button and share with us if you do get screenings. Let us know how that goes, and please keep me updated with your health and wellness progress. And if you love this type of content, make sure you hit the follow, like button, subscribe, all of that good stuff. I will be posting videos now once a week. I'll see you on our next video next week.